Whether you call it queefing, a fanny fart, or more medical terms like vaginal flatulence or vaginal wind, this happens to a lot of people. So let's talk about why it happens, if it's normal, and what you can do about it. I'm Dr. Alex Hill. I'm a board-certified pelvic health and oncology physical therapist. And if you're curious about pelvic health symptoms that no one seems to talk about, like vaginal flatulence, make sure you subscribe. I'm here to get you informed and empowered about your body. Vaginal flatulence, also called vaginal wind or queefing, is the release of air that's trapped in the vaginal canal. Some studies show that upwards of 70% of people with a vagina will experience it. It can make a sound similar to passing gas from the rectum and the anus, but it's not related to digestion, so it's not going to have an odor. It typically happens during or after intercourse, exercise, or physical activity. And while it's typically harmless, it can be embarrassing for a lot of people. So let's orient you to the pelvis. So we have the pelvic bones here, we have the spine. In the middle here, we have the organs. So at the back, we have the rectum, and then we have the uterus, which is connected to the vagina. And then at the front, we have the bladder. So if I take out the uterus, you can see that, again, that uterus is connected to the vagina. The vagina is just a muscular tube. Now, if we also look at that from the outside, we have the vaginal opening here, and you can see that long vaginal tube. And so vaginal flatulence occurs when air comes into that vaginal tube and gets trapped. And then when you move, especially in a way that changes your pressure or position, that trapped air has nowhere else to go, so it gets pushed out of the vagina and can cause that vaginal noise. Air could enter the vagina with movement, positions that open the vaginal canal like certain sexual positions or movements like downward dog in yoga, or during any type of vaginal penetration. And yes, that includes vaginal activity, inserting menstrual products, and even medical pelvic exams. So let's now talk about who might be more likely to experience vaginal wind. It tends to happen more commonly among those who have a wider vaginal opening, a history of vaginal childbirth, pelvic organ prolapse, pelvic weakness, or if you have pelvic floor muscles that are too tight and overactive, urinary incontinence or leakage, after pelvic surgery or radiation therapy for cancer treatment, and more often among younger people. Another possible factor that does need to be researched a little bit more includes having a lower BMI or body mass index. Most of the time, vaginal wind is completely harmless, but if it's accompanied with other symptoms like odor, discharge, or pain, especially pain after a surgery, check with your medical provider to rule out some other more rare causes. Most importantly, there's typically nothing to be worried about and nothing to be embarrassed about. Vaginal wind is normal. It happens to a lot of people, and it doesn't mean that there's something wrong with you. Again, it's just air getting trapped into a small space and having nowhere else to go but out. If it's not bothering you, just laugh it off and keep going. If it is bothering you though, here are a few ways that you can manage it. First, as a pelvic health physical therapist, of course I have to talk about pelvic floor exercises, otherwise known as Kegels, repeated contractions. Strengthening and improving the coordination of the pelvic floor can help reduce the amount of air entering the vagina for some people. You can also try doing a Kegel or contraction during a movement change, like as you change yoga positions. But there is not very strong evidence that doing pelvic floor exercises regularly will resolve vaginal wind. But if you do want to work on your pelvic floor exercises, keep watching to the end to get a video on how to actually perform them correctly and make sure that you're doing them right. Something else you could try is using a pessary, a tampon, or a menstrual cup. Pessaries are small devices that are usually silicone, and you can insert and remove it yourself vaginally. They're typically used for pelvic organ prolapse and incontinence, and you would need to see a healthcare provider to get fitted for one. Research shows, though, that pessaries, tampons, and menstrual cups can be helpful since these devices can act as physical barriers that reduce the space where air can get trapped, and also by supporting the organs, especially if you have prolapse. Now, these devices are especially helpful during exercise, but you would need to remove them during penetrative sexual activity. And my last tip is to be mindful of the positions that you're in during sexual activity. Certain positions, like if your hips are elevated, if you're on your hands and knees, or if your legs are widely spread, might allow more air to enter. So you can try just adjusting your position to see what reduces the amount of air that gets pushed in. So just to recap, vaginal wind is totally normal. There's nothing to worry about except in very rare cases, but you can try these tips if you're bothered by that vaginal noise. If you found this video helpful, please give it a like, subscribe for more pelvic health tips, and share this with a friend who's probably wondering the same thing.